we haven't seen you or spoken with you in a couple of weeks now, and so I'm happy that you are back, Miss Sylvia Lemus from the county of Sonoma. You always bring us a lot of information for our community to be up to date as to what's going on, not just about COVID and the fires and other things, but it's always wonderful to get the information directly from you. What do you have for us today?
Yes, thank you, Rafael. Thank you for having me. I'm glad to be back and provide information. And so I did want to give you a COVID update, but the first thing I wanted to say is that we know that President Biden this week came out and said that the pandemic is over, that COVID is no longer, but at the same time, we do have to say that COVID is still with us. It has just changed. It's no longer a COVID emergency, but we still now have to live with COVID among us. So we know that there's variants, and we know that it's still in the community. We see it in the numbers in the hospitalizations. So we still have to kind of be careful when we're out in the community. So just to share some data, Rafael, the numbers are coming down. So we do see that numbers are coming down. We don't know if it's because numbers are coming down or maybe people aren't reporting as much, when they're sick. But right now the case rate is 9.8 per 100,000, which is low. But it does make a difference if you're vaccinated or unvaccinated. In the unvaccinated, 24.8 per 100,000. And in the vaccinated population, it's 8.9 per 100,000. So there's a big difference whether you're vaccinated or not. The testing positivity right now is also low at 6.8% overall. And then the lowest quartile of the Healthy Place Index, it's 8.6%. A little bit higher there, but overall it's still lower than it has been for a long time. And as far as vaccinations, right now we have 78% of our total eligible population that is fully vaccinated, with 6% that are partially, haven't gotten yet to the fully. So that means that we have at least 84% that have received some type of vaccination at some point, So we do know that, but we also do know that we have 16% that remain unvaccinated. So we don't know whether that 16% will or not become vaccinated, but those are just what the numbers are showing us right now. As far as deaths in the community, unfortunately, we lost 2 more people in the last week. So we have a total of 516 deaths so far from COVID here in Sonoma County since the start of the pandemic. In our hospitals right now, we're seeing that we have 28 people that are in the hospital for COVID-related illness, and 1 person is in the ICU. And as far as MPOX, we currently have 40 people right now that are cases of MPOX here in Sonoma County. So that's kind of what the data looks like right now, Rafael. I wanted to move on to clinics if you wanted me to share some information
Yeah,
on.
definitely. I think it's important for people to know that the vaccines are still available for people who haven't gotten vaccinated and that people can get tested still for COVID.
Yes. Yes. So I just want to share a little bit about the clinics that are available right now. The first things that we tell people is to please at first check with your healthcare provider. And if you have one, and see if they have, or your clinic that you go to, if they have vaccines that you can get. Many of the pharmacies are also offering vaccines. For example, I'm going to Safeway to get my vaccine, the bivalent vaccine, the booster. So they also have the bivalent. So a lot of the places have not just the regular vaccines, but also the bivalent booster, which is the one that replaced the boosters. So for pharmacies, if you go to myturn.ca.gov, you can make an appointment in your area, and like CVS, Safeway, different kind of pharmacies in the area will have appointments, so you can make an appointment there. And as well as different clinics that the county supports and works with. In Hillsburg, there's a Alliance Medical Center, and you can go to alliancemed.org to find out about appointments or going to the Alliance Medical Center. In Walnut Park, at the community center, there's still vaccines there. And for that, LHI is the contractor that gives vaccines there. And you can make an appointment at myturn.ca.gov. And also at Santa Rosa, we still have them at Roseland, the Roseland site, at least through October 15th. And then it's going to move. We're hearing it might move to Mitote Food Park, but we're trying to finalize some plans. But right now, in Santa Rosa, it's at the Roseland Community Center. Yeah, community center. And Fox Home Health, you can go on foxhomehealth.com for information on vaccines. And also in Santa Rosa, the Jewish Free Community Clinic also offers vaccines. And their number is 707-585-7780. In Sonoma, the Sonoma Valley Community Center offers vaccines at their clinic. And also to let you know that these clinics not only offer the vaccine, the bivalent booster. They also offer flu vaccines. And so that's another thing that you can do while you're at it is take care of the boosters and the vaccines and the flu vaccine at the same time, the flu shot. As far as testing clinics right now, we do have some testing clinics available. The Fox Home Health Center in Santa Rosa and Roseland still has testing. And also LHI offers testing at some different locations. For LHI, if you visit lhi.care/COVID testing, you can get more information or go to tocoemergency.org. We still have information in there under vaccine and under testing. And another thing people can do, Rafael, is I want to remind them that the phone number 565-4667 is still available in English and in Spanish. There may not be someone, you might not get a live person when you call, but you can leave a message and then someone from the office will call you back with information. Just to give you an example, I got a call from someone in the health department because I had taken a test some time ago. So they were just kind of following up to see if I needed any more other resources. So I know that they are attending that line and they're following up. So it's just an example. So at 707-565-4667. And remember that SoCoEmergency.org has a lot more information, and we're keeping that updated with information as well.
There's a lot of information, as always, that you're always bringing to us and the community in general, because, again, we need to understand that COVID will be with us from now on. We just need to understand to take care of ourselves and take care of the ones that may not be able to vaccinate. So I'm always grateful for that information because the community needs it, definitely.
Yes. And there's different events, Rafael, there's different community events happening where they are including vaccinations and maybe even testing as part of their event. For example, this Saturday, there's the South Park Day and Night Festivals happening this Saturday. And from 2 to 4, they're going to have vaccines available. So Fox Home Health is going to be giving out vaccines. And it looks like for people that get vaccines, you're going to get a coupon to get a piece of pizza that they have there. So it's a festival it's a South Park Day and Night Festival, which is now Martin Luther King Park, Junior Park. Yeah. So they'll have different events for the family and different booths and everything, but vaccines, they will have there from 2 to 4 p.m.
Definitely. So again, participate in those activities is definitely helpful. And again, Líderes del Futuro, Latinx Student Congress, and other organizations are going to be at Elsie Allen High School on Saturday for the Mexican consulate visit. And we are going to be giving away 1,100 individual COVID tests, and we'll have some masks. And then we're going to have other nonprofit organizations also tabling at our event. So again, find them, get those resources, make sure that you use them. It's important that we take care of ourselves. Is there anything else you may have for us?
Yeah, Rafael, I also wanted to talk to the public about registering in the elections because we know that that's coming up right now. And voting is so important for a community. And it's important that if people are eligible to vote, that they are registered. And if they haven't registered, then I have information to share with them on that. So in order to be eligible to vote in California, a person must be a U.S. citizen, must be at least 18 years old on or before Election Day, and not in prison for a conviction of a felony. So those are the only requirements to be able to vote. So so people can go directly to the office to pick up forms to complete them. Sometimes you see them at different locations or events. There might be people there registering people, but the office is the Sonoma County Register of Voters at 435 Fiscal Drive in Santa Rosa, and they're open regular Monday to Friday business hours from 8 to 5. You can also call and have the forms sent to them, and the phone number is 707-565-6800. And they also provide information in Spanish and English. So they even have phone staff available to help in Spanish as well. So the election is on November 8th of this year, and the last day to register to vote in the election is October 24th. So it's really important to not miss that date, and people have to register by October 24th. And even if they have moved or changed their name, they have to re-register. So they've moved. If they've changed their name, they have to re-register. So we want people to be prepared and to vote. Let's see. So anyway, that's just really important information we wanted to share with people today.
Definitely, as I tell my students at Santa Rosa Junior College, and Mecha de SRJC goes classroom to classroom every election, and we put these big signs that say local elections are just as important as national elections. we're going to be electing members of city council, school boards, and other important positions that affect ourselves and our children. And so it's important that people participate in this upcoming elections. And so, as always, Ms. Sylvia Lemus, we want to thank you for bringing all of this information, and I look forward to the opportunity to be able to have another dialogue in the very near future. So thank you for taking the
Thank you,
time
Rafael.
and being here. Thank you.
Thank
Take
you so
care.
much for having me. Okay, bye-bye.
Bye bye.